Happy times, dear followers, and welcome to a new episode of Psychopathology. This episode is titled Hallucinatory Syndromes. Hallucinatory syndromes, also referred to as hallucinosis, describe conditions where persistent hallucinations occur across different sensory modalities without the presence of other psychotic symptoms. Several distinct syndromes are recognized within this category. Alcoholic hallucinosis. Auditory hallucinations often emerge during periods of relative sobriety following prolonged alcohol consumption. These voices can be hostile or accusatory, although some individuals report hearing benign or neutral voices. Despite the intensity of these experiences, consciousness remains clear, and hallucinations typically subside within a week. Organic hallucinosis. Present in approximately 20 to 30% of individuals with dementia, especially Alzheimer's disease, these hallucinations are predominantly auditory or visual. Patients affected also display signs of disorientation and impaired memory. Special categories of hallucinations. Beyond common hallucinatory experiences, several unique subtypes exist. Functional hallucinations. These hallucinations occur alongside and are dependent on a real sensory stimulus. For example, a person with schizophrenia might hear a divine voice whenever their clock ticks, or perceive voices emerging from the running water in a tap, or the chirping of birds. Unlike illusions, these hallucinations do not replace the sensory stimulus, but exist alongside it. Some individuals manage these experiences by reducing external stimuli, such as wearing earplugs, to lessen the intensity of the hallucinations. Reflex hallucinations. A pathological form of synesthesia. Reflex hallucinations occur when a stimulus in one sensory modality triggers a hallucinatory experience in another. A patient may, for instance, experience a headache, which is a somatic hallucination, triggered by hearing someone sneeze, believing the sneeze directly causes their pain. While synesthesia can occur under the influence of hallucinogens like LSD or mescaline, leading to simultaneous experiences of colors, sounds, and taste, reflex hallucinations represent an abnormal extension of this phenomenon. Extracampine hallucinations. These involve perceiving hallucinations outside the normal range of sensory experience. A patient might report seeing someone standing behind them while looking straight ahead, or hear voices conversing in a distant location. Though they can occur in healthy individuals, particularly as hypnagogic hallucinations, they are also linked to schizophrenia, epilepsy, and various organic disorders. Otoscopy, or phantom mirror image. Otoscopy or phantom mirror image hallucinations involve perceiving a duplicate of oneself and recognizing it as an external reflection of their own being. Unlike simple visual hallucinations, otoscopy integrates kinesthetic and somatic sensations, making the experience feel deeply immersive. It can appear in emotionally distressed individuals or those experiencing exhaustion. While hysteria can sometimes induce otoscopy, it is also found in schizophrenia, epilepsy, and neurological disorders affecting the parieto-occipital region of the brain. Folklore, particularly in German traditions, associates otoscopic experiences with impending death. echoing reports of doppelganger sightings. Some individuals experience negative otoscopy, where they fail to see their reflection in a mirror, or internal otoscopy, where they claim to see their own internal organs. Hypnagogic and hypnopompic hallucinations. First documented by Aristotle, hypnagogic hallucinations occur when drifting into sleep, while hypnopompic hallucinations manifest upon waking. Importantly, these experiences do not indicate any underlying psychopathology, though they are linked to conditions such as narcolepsy. Hypnagogic hallucinations are discontinuous, occurring suddenly and intrusively without forming part of a dream. They are approximately 3 times more common than hypnopompic hallucinations, with 37% of adults reporting such experiences. Auditory hallucinations in these states can involve hearing one's name spoken or meaningless phrases, while visual phenomena often include geometric patterns, faces, or scenes from nature. EEG studies confirm that individuals experiencing hypnagogic hallucinations are not fully awake, with recordings showing decreased alpha wave activity at the time of hallucination. Sleep deprivation can trigger a hypnagogic state, leading to hallucinatory voices, visual distortions, and ideas of reference, all of which resolve upon restful sleep. Organic hallucinations and phantom sensations. Organic hallucinations can appear in various neurological and psychiatric conditions, spanning all sensory modalities. Visual hallucinations. These may occur due to eye disorders, central nervous system diseases, or damage to the optic tract. Complex scenic hallucinations frequently accompany temporal lobe lesions. One prominent example is Charles Bonnet syndrome, which presents as vivid visual hallucinations in individuals with deteriorating eyesight, but no other psychiatric symptoms. Somatic hallucinations and phantom limbs. Among organic somatic hallucinations, the phantom limb phenomenon is the most prevalent. This occurs when a person feels sensations from a limb that has either been amputated or has lost sensory function due to neurological damage. Remarkably, 95% of amputees experience phantom sensations, sometimes perceiving the limb as shorter or incomplete. In rare cases involving thalamoparietal lesions, individuals report sensing an extra limb. Similar phantom sensations occur following procedures such as mastectomy, eye inoculation, or larynx removal, where patients continue to feel the presence of the absent organ. Parietal and temporal lobe contributions. While parietal lobe lesions are linked to somatic hallucinations and bodily distortions, temporal lobe damage tends to result in multisensory hallucinations, excluding somatic ones. Psychological reactions to hallucinations. Patients experiencing organic visual hallucinations often react with intense fear, attempting to escape perceived threats. In delirium, this terror can lead to impulsive behavior, including jumping out of windows. In contrast, Lilliputian hallucinations, which involve seeing miniature people, are usually met with amusement rather than distress. Responses to auditory hallucinations vary. Depressed individuals often hear voices insulting them or encouraging self-harm, but they may not feel afraid, accepting the voices as deserved punishment. Acute schizophrenia can trigger extreme distress, sometimes leading patients to attack perceived sources of the voices. Chronic schizophrenia patients may grow accustomed to their voices, treating them as familiar entities. Distortions of body image. Hallucinations can alter an individual's perceptions of their body. Hyperschemasia. The sensation of body parts appearing exaggerated or enlarged, commonly reported during pain, paralysis, vascular disease, multiple sclerosis, and cerebral infarctions. It also occurs in hypochondriasis, depersonalization, and anorexia nervosa, where individuals perceive themselves as overweight despite objective evidence. Ischemasia and hyposchemasia. The absence or diminishment of body parts, typically seen in partial lobe lesions and spinal cord injuries. Some individuals also experience negative photoscopy, where they look in the mirror and fail to see their reflection. Paraschemasia, a feeling of distorted or twisted body parts linked to hallucinogenous epilepsy and migraine auras. Koro syndrome, predominantly seen in Southeast Asia. Koro is the belief that the penis is shrinking and retracting into the abdomen, leading to fatal consequences. It is often interpreted as an anxiety disorder rooted in cultural misconceptions about anatomy. Semisomatoagnosia and anosognosia, a unilateral lack of body awareness following strokes or neurological disorders. Some individuals with right hemisphere lesions deny their paralysis entirely, refusing to acknowledge weakness in their affected limb. This version of hallucination related to body parts is the final part of this episode. Thank you for following and listening to us, and see you in more episode in the future.